Hello, you may be thinking, why do I need a follow-up consultation? I've had my initial consultation, I felt heard, I felt listened to, I had all my symptoms explored, I discussed lifestyle, I had a treatment plan, and I've gone off and I've done that and all is well. That's great. However, NICE guidelines do recommend a review for all women 3 months after any initiation of HRT treatment or any significant change in HRT treatment. And that's what we comply with at Health and Menopause. From my perspective as a doctor, I love the follow-up consultations. The initial consultation can be quite overwhelming for women. They're often quite anxious, they're a bit wary of who they're going to meet, they don't know how the consultation is going to go, and sometimes that overwhelm can mean that they don't take in everything that's been discussed. So at the follow-up consultation, I like to just go over how they've understood, how they've gotten on with the recommendations that we've made, in particular if the medication has suited them. Have they had any difficulty with using the medication, with remembering to take the medication? Has there been any side effects that haven't resolved over the 3 months? And together we review benefits and side effects and adjust and modify treatment to suit. Furthermore, we can discuss more intimate things that we may not have had time to discuss at the first consultation when things are a bit sensitive, such as genital health, vaginal dryness, pain on intercourse, sexual function, sexual arousal, sexual satisfaction. So these are all really important topics that we want to help resolve for women. NICE guidelines recommend a routine review after 3 months. Once things are stable at 6 months, and then if everything's the same at the 6 month review, annually thereafter. So once a year is all you need to have a review. Many women will go off and have their GP prescribe their medication, which is great because they can have the prescriptions on the NHS, but unfortunately that prescription often gets stuck in time. Now, what we know about the menopause journey is it's exactly that, it's a journey. It's not stable, particularly in the perimenopause when the ovaries are failing but still active, and they can produce hormones in a very erratic fashion which can precipitate symptoms which women often struggle to understand, often blame their HRT, and sometimes just discussing what's happening and adjusting and modifying HRT can help manage those symptoms. Once you're into menopause and the ovaries have ceased functioning, other symptoms can start to creep in that perhaps weren't there before. Like we said, vaginal dryness, pain on intercourse, urinary tract infection, itch and irritation of the vulva, low libido, and often these are not attributed to the drop in estrogen hormone levels. So again, we can just make sure that we're asking about these symptoms specifically, because these symptoms have a very significant impact on female sexual function, and female sexual function is very important for our well-being, for our health, for our sleep, for our anxiety management, and also for our immune system. So it's a very important part of holistic health. So there are lots of reasons that women will have a follow-up appointment, as I say, as a routine as recommended by NICE. Sometimes women will have gone away and the symptoms start to come back, or they'll start to get side effects because something else has changed. Often you'll have a new health condition diagnosed and that can impact on your treatment and your symptoms. Some medications will cause the vaginal dryness symptoms that we've spoken about, and it just gives an opportunity to have that overall look at your health and well-being. Part of our care at Health and Menopause is to ensure that women live the best possible lives that they can. So symptoms may have got better, but if you're not at your best, then really that's not good enough. We also like to look at overall health, make sure that you've had the screening procedures that you have, make sure that you're looking after your cardiovascular health, make sure you're looking after your bone health. And sometimes it's just a friendly reminder of what you can do to try and optimise your future life so that you're living long, healthy lives. So if you haven't had a review recently and you're thinking, I'm not feeling quite as good as I should, please come back and see us. If you have had a review within 12 months, you can of course contact us by email and we will respond to your queries. If you are out with that 12-month window, medical legally we are not allowed to reply to those questions. So it's worthwhile just having an annual review so that should anything else creep up, you can ask our opinion as to whether or not there's anything can be done to help. So if you have noticed that you're not quite as well as you were when you first started your HRT, or you started to see new symptoms appear that weren't there in the first place, or you're just a bit confused about where you are in your journey or what you can do to make sure that you're living your best possible life, we'd love to see you at any point in time. So please, if you need our help, we're always here, you're always welcome. Please book an appointment. We look forward to seeing you.